and welcome to Askimo TV. We're talking today to Martin Samuel. Martin is a speech and language therapist specializing in acquired and degenerative adult neurological conditions and teenage and adult stammering. Hi Martin, how are you?
I'm very well. Morning, Joanne.
Wonderful. Today we're going to talk about stuttering in teenagers. So let's begin with what is stuttering and is it different from stammering?
Okay, well, stuttering and stammering are essentially different names for the same difficulty. In the United Kingdom, we generally use stammering, though I know in the United States and Australia, stuttering is more frequently used.
What causes stuttering or stammering?
We don't actually know what causes stuttering or stammering. Certainly, there are some suggestions that there may be some kind of gene that's involved sometimes, and there is also a familial link sometimes. So there are sometimes stammering runs in families, but it doesn't necessarily mean that just say because the mother or the father has stammered that the child will then stammer.
Is stuttering considered a speech impediment or a learning disability? Neither? Both?
So a stammer is not a learning disability. People who stammer will have the same range of intelligence as those who do not stammer. The term speech impediment is now a slightly old-fashioned term, and it is not generally used by professionals in the United Kingdom anymore. Really, speech impediment implies that the person's stammer prevents them from doing certain things. And the view of stammering these days is that as long as it is managed well, then the person is really able to achieve what they want in life.
Does stuttering affect boys or girls more, and why?
Like nearly all developmental communication disorders, there are many more boys who are affected than girls. In stammering, there are about 4 boys for every 1 girl who stammers, though we are not entirely sure why. There is some suggestion that it is to do with the kind of makeup of male and female brains, but further studies really needed in these areas.
How would you treat a teenager who is a stutterer?
How you treat teenagers really depends upon the age of the person that you're treating, as well as the severity and the characteristics of the stammer, e.g. whether it is severe or mild, what does the person do when they actually stammer. The first step, I think, is to realise that developing a positive approach will start to make other things happen. Teenagers are often very aware of how they are seen by others, so it can be difficult to treat. Most teenagers can begin to change and modify their speech behaviour to achieve improvement in speech fluency, though. Often group programs work well with teenagers. This is where the person can carry out and try therapy in a safe environment with other people who stammer. At other times, one-on-one therapy is appropriate. There is no one course of prescriptive treatment for each group, and there is no cure for stammering.
What tips or advice do you have for teenagers on how to cope or deal with the stutter in the school setting?
What I would advise the teenagers is to really seek help from a professional speech and language therapist who specialises in stammering. The stammer can be controlled more effectively to make communication easier. It will often take quite a bit of hard work, and the person who stammers may need to dip in and out of therapy over time. Just because therapy hasn't solved the issue once doesn't mean to say it can't be useful in the future.
What tips or advice do you have for people, whether it's family, friends, teachers, on how to try and communicate with a teenager who is stuttering?
The first thing is to be patient and to understand that the person will say their message given sufficient time. Generally, people should not complete the stammerer's sentence for them, as most people dislike this. If the person who stammers wants to talk about their stammer, then do so in a non-judgmental way. Parents need to understand the problems teenagers have so they can develop strategies with them which will improve their confidence when speaking with them. It is important to be honest and open about the stammer. Teachers need to be aware that the student who stammers may be anxious when, for example, reading in class, responding to questions, so it's important to try and tailor the learning to take account of their difficulties. Small group work and non-direct questioning can help to make the person who stammers less anxious, but equally, the person who stammers should not be treated differently to others in the class, as this can signal them out as receiving special or preferential treatment.
Thank you, Martin. Thank you so much for talking to me today.
You're welcome. Thank you.